Hi guys, welcome back to another video. So today's video is for all my nurse practitioner students, my aspiring nurse practitioner student. This video is for you. I am going to be sharing with you guys how to prepare for clinicals as a NP student. What are the essential things that I think you need to have as a NP student, and how just to make your clinicals a little less stressful. Now I know that with the pandemic, a lot of you guys, your clinicals are at a standstill. If you were in clinicals, you have to stop. If you were preparing to go to clinicals, a lot of these clinical sites are shut down, but rest assured you will be starting your clinicals again when this is all said and over. So keep this video in your file folder, pull it out when it's time for you to go to clinicals. Better yet, while you're in isolation, do some of these things so that you can be prepared when your clinicals start back up. Now let's get into this video. Number one, the first thing I want to say is kind of a no-brainer, but I'm going to say it anyways. You need to have a proper stethoscope. Yes, you need a proper stethoscope. You'll be surprised how many nurses, NPs, even physicians that don't have a proper stethoscope or even have a stethoscope. Like, you need a proper stethoscope. And I'm saying this because in nursing school, yes, they teach us to listen to lung sounds, heart tones, but a lot of nurses don't really listen to heart tones. We pretty much listen to the lungs and carry on about our business. And honestly, I know that sometimes I'm guilty of that, but now that you're going into the whole practitioner role, you need to now start practicing yourself and being familiar with listening to lung sounds, heart tones, recognizing heart murmurs, and all of that. And if you are a nurse who does not have a lot of experiences with listening to heart murmurs, now this is the time for you to Google is your friend. Trust me and believe me, Google is your friend. Even myself, that used to be an ICU nurse, I was a medical surgical ICU nurse. I did not have a ton load of experiences with heart murmurs. Of course, if it was loud across pericardium, I didn't have a problem identifying that. But like subtle heart murmurs and stuff, no, I didn't have a lot of experience listening to those. So you can Google these sounds. Of course, you're not a cardiology and we're not expecting you to grade the heart murmurs, but it's good for you to recognize these sounds and put this in your progress note. Like, patient has a positive systolic murmur. It is just good to recognize these sounds. Now, if you are a nurse already, you already know how clinical goes as a nurse. You go to clinicals, you have like 6 or 7 other students with you, depending how large your clinical group is, and you also have a clinical instructor. As a nurse practitioner student, it is different. You are pretty much at your clinical site with the preceptor that you choose, and it's just you and that preceptor. So if you're somebody like me who kind of like to dip in the back because you don't want anybody to call on you whether you know the answer or not, you're going to be front and center. You're in the big leagues now, as they would say, and they're going to be calling on you. The thing is, as a NP student, there's so much decision that needs to be made in that 8 to 12 hours, however long you're there for your clinicals. And I want you as a student to get into the habit of acting like you are the practitioner, because once you are done with this and you graduate, I'm telling you, as a nurse practitioner, you don't get precepted. You pretty much find a job and you are thrown to the wolves. At least in my case, there's no precepting that's pretty much going on. So this is a time for you to soak up all the information that you need to soak up from your preceptor and act as if you are the practitioner, because you kind of have that person holding your hands a little bit while you are learning. There's a couple of things and a couple of essentials that you need as a nurse practitioner student. I already told you guys about getting a decent stethoscope. The next thing that I think every NP student should have, you should definitely try to get yourself a pocket manual, some kind of pocket guide that's going to help you while you're in clinicals. There is ton loads of them on Amazon. When I was a student, I pretty much just went to Amazon, Googled pocket manuals, read the reviews for them, and kind of just made my decision. The one that I use most of the time when I was a student, I don't have it with me right now, I loaned it out. I'm gonna put it on my screen just to show you the cover of it. I liked it, nothing was wrong with it. And now now I actually have this one. It is Pocket Primary Care. This is the second edition. If you are a nurse practitioner student or you've graduated, let's know in the comments which one you use so we can probably help each other out sharing the different books that we use. I think that having a pocket guide when you are in clinicals is gonna help you and aid you while you're there. Me personally, there's a lot of apps that you can download on your phone, but I am a person, I like to write things down. I like to skip my pages and look stuff up that way. Once you are a student, you are the practitioner, like I said, so you are diagnosing patient, coming up with a treatment plan. You're not gonna walk into a patient's room and say the patient is complaining of cough, and you're just gonna come back out to your preceptor and say, Mr. B has been coughing for 4 months, his vitals are okay. No, that's not it. You are the practitioner, so you're gonna have to ask certain questions to find out, why is Mr. B been coughing for 4 months? Does Mr. B smoke? Does Mr. B has a history of asthma? Does Mr. B have any gastric reflux? How long is the cough going on? What precipitate the cough? There's different things that you need to be asking, so when you come back to your preceptor, you kind of have the ball rolling in your head, trying to figure out, okay, why is this cough going on and what are we going to do to figure out why it's going on. Next thing that you need, in my opinion, as a student, it is the perfect H&P Plus. I showed this book in my What's in My NP bag. I did not know about this book when I was a student, and I just found out about it, and I really wanted to share with all my NP students. It is really imperative that you know how to write a good progress note and a good H&P note. Honestly, did not start writing decent progress note until after I graduated and I started working, and my boss, shout out to him, helped me with structuring my progress notes properly. So I'm going to mostly talk about primary care, FNP, because I am primary care. As a FNP student, what you really need to realize is that primary care is mostly managing patients and their chronic illnesses. Every now and then you get a monkey wrench thrown in there, but it's mostly managing patients and their chronic illnesses. How are you going to manage patients with their hypertension, their diabetes, their high cholesterol, and knowing guidelines? And I said in one of my other videos that I was nervous in the beginning. I didn't want to start blood pressure meds. I didn't want to do this. I didn't want to do that because I was scared. However, if you are newer and you're following your guidelines and you're following what evidence-based practice is, that is safe and your best bet. It's almost like 90% of the population have high blood pressure, and you're managing these patients with their high blood pressure. I definitely recommend that you familiarize yourself with the JNC8 guidelines and how to manage patients with their blood pressure. When to start them on a blood pressure medication. What is your target blood pressure for patients? A lot of people still think that 120/80 is normal blood pressure, and that's really not it. We want your blood pressure to be less than 120/80. So you need to kind of familiarize yourself with these things. When are you starting a patient on blood pressure medication? When are you going to increase the blood pressure medication? When is it a good time to add another blood pressure medication? There is a guide that I used when I was a student. I will put it up on the screen. I use this. You don't have to write it down. I wrote it down because I like to write things on in my own handwriting so I remember things. If your patient have kidney failure, which medication is best to use in this type of patient? What's best to use in a patient who has like COPD or asthma? So there's different little things. As a student, honestly, I do think that you should get yourself comfortable in knowing these things and recognizing these signs so that once you are the practitioner, it is like second nature to you. Also for primary care, the biggest thing is also, in my opinion, is prevention. A lot of times for our patients, we do not start them right away on like a cholesterol medication. A lot of times we tell them to modify their lifestyle. It's also about educating patients and preventing. The next tip I will give you as a nurse practitioner student is knowing how to do a proper full head to toe physical. When I was a student, I practiced this tirelessly on my husband. He was sick and tired of me. I was practicing it from head to toe. And there's a lot of videos on YouTube about this. I might do one to put up on my channel as reference for you guys if you want me to, but you really need to know how to do a proper head to toe. I know from my school, this is something that they checked us off on. Like, we had a instructor watching us doing a full physical head to toe on a patient. And I will also say, when it comes on to like your otoscope and all of those tools that we use, practice using them. You know, even if you have to buy a little cheap one off of Amazon, practicing using them, practicing looking in the ear and looking at landmarks so you know what you're looking for. So these are things that you can do now when you're in quarantine. Like I said, because I'm family, you also do your peds and your OB. I will tell you that for pediatrics, the biggest things in pediatrics is milestones and vaccination, and those are actually also on boards. So Bright Future is going to be your best friend. Bright Future, I did see a Bright Future manual on Amazon. I'll put it on the screen to show you what it looks like. I didn't have to buy this when I was a student because my instructor that I had, she actually printed it, copied it for everyone in the class, so I didn't have to buy it. So pediatrics, when you're doing your pediatrics clinicals, a tip for you also, when I was doing my pediatric rotation, the pediatrician that was precepting me, you know, she also said to me, when the moms come in, have like a casual conversation with them, and you're truly checking also to see if mom has postpartum depression. So once you're there looking over baby, you're casually talking to mom and just saying, how are you sleeping? How is going on? What is going on with you? Because a lot of times moms have postpartum depression and they're not saying anything. For the OB section, for my OB clinicals, the biggest thing now is you're caring for mom and baby. So now you have to be very careful in the medications and the different things that you prescribe for mom, because now you have two lives, mom's life and baby's life. So the next thing when it comes on to OB, when it comes on to you doing your pap smear, there's no way for me to give you an easy way of how to do it. Once you do it a couple of times, you're gonna get the hang of it. I watched a lot of YouTube videos when I was going to do my OB clinicals, and none of them prepared me really to do it. You're just gonna have to get a hang of it and just have to do it. I am going to give you a tip though. Make sure that when you are doing your patient's pap smear, you get enough sample to send to the lab, because if you're a woman and you've had a pap smear done, you know how uncomfortable that thing is, and you do not want to be the practitioner that didn't get enough sample, and when you send it to the lab, they call you back and say there was enough sample in this for us to do anything. Patient has to now come back to get it redone. Who is going to make that phone call? That patient is going to be super angry and super pissed. So just make sure you get enough sample when it comes on to you doing your pap smear on your patient. Those are basically my tips for you when it comes on to preparing yourself as a nurse practitioner student. That is it, guys. I hope this helped you out in more ways than one. If I didn't cover anything, let me know in the comments. Ask away any questions you have for me. And as always, thank you guys so much for watching. Don't forget to like, comment, and subscribe, and I'll definitely catch you guys up on my next one. Bye, guys.